It's hard to believe, but the first day of school is just 2 weeks away. Teachers are preparing lesson plans, and kids are enjoying the last few days of summer freedom. Setting up healthy back-to-school routines helps kids succeed during the year. Reporter Dranusha Jasufi sat down with Cambridge Health Alliance pediatrician Dr. Sarah Canale and brings us these tips for a healthy and low-stress return to the school year.
I think it's one of the most important pieces of returning to school is getting the whole family back on a good schedule where everyone's eating breakfast in the morning. You know, if your schedule doesn't allow for it, to eat breakfast sitting down, taking something like a yogurt and a piece of fruit with you so that you eat something prior to starting school. And in addition to with dinner time, I know people are busy, but if there's 15 minutes where the whole family can sit down together, eat a nice healthy meal, talk about the day, I think that's one of the most important pieces of getting back to school.
Getting back to a regular school schedule is another health factor in school success.
Bedtime, another thing that comes up. Over the summer, a lot of kids are staying up later, sleeping in. That's not going to work for the school schedule. So getting, everyone in the house, turning off the media at a certain time of night, maybe an hour before bedtime, getting into a routine, a rhythm prior to going to bed, whether it be brushing your teeth and then reading a book, no TV with sleeping. A lot of kids think it helps to fall asleep to TV, and it actually doesn't really help in terms of getting good night's sleep. And we notice, kids who have a good routine are eating breakfast and getting a good night's sleep, that they tend to do better in school. They're concentrating better. They tend to have less complaints of headaches and belly aches. And they also, just in general are physically and emotionally, healthier.
Dr. Canale suggests reviewing transportation safety with your child before the school year begins.
Really considering a lot of the safety precautions ahead of time is very important. So for example, if your kid's going to be walking to school, see if there's other kids in the neighborhood or another grown-up or yourself that can walk the kids to school. Make sure they're wearing brightly colored clothes so they're visible to people driving their cars, and make sure they know the designated spaces or the crosswalks to get safely across the street. I think that is incredibly important. In terms of bus transportation, a lot of kids don't think about some of the safety components of it. So making sure that your child knows where the bus stop is, to make sure that they can see the eyes of the bus driver and the bus driver can then see them. And then, as they're waiting for the bus, making sure that they stay still as the bus comes to a complete stop, and then have them proceed to get onto the bus.
Review required vaccinations before heading off to school.
Usually, if kids keep up with their yearly health physicals, then we're able to take care of those vaccinations during those visits. Examples would be getting the measles, mumps, rubella, and the chickenpox vaccine prior to going into preschool or at 4 years of age. At that same age, kids also need an updated booster shot of their diphtheria, tetanus, pertussis, as well as their polio.
Routine vaccinations continue throughout the school years. Obtaining yearly physicals for the children is important in keeping them up to date with all the required vaccinations. And don't forget sports physicals if your child plans to participate in a school sport.
We also delve into, risks in terms of family history or symptoms that they're having that could put them in harm's way playing sports. And we want to make sure we identify that ahead of time prior to having them participate, even in training over the summer.
Asthma and allergies often require medication be available during the school day. Review these with your pediatrician, child, and the school health office.
Depending on a child's age, kids can self-administer the EpiPen. That being said, it should be kept in the nurse's office. The nurse should be aware of it. The nurse should know how to administer the EpiPen. But in certain situations, it might be up to the student to have to do it. So we tell parents to make sure they have one EpiPen that either stays at home or travels with the kid, and one EpiPen that stays in the nurse's office.
Parents should also monitor their children for signs of depression and anxiety.
We do see a fair amount of depression, anxiety in some of our kids, and a lot of them relate to their social interactions. And so really being able to be a sounding board for your child, to hear their concerns, to validate their feelings, and to offer them some advice on how to deal with these things is really important.
For Somerville Neighborhood News, I'm Janusha Yusufi.
For more health information from the Somerville Public Schools, visit somerville.k12.ma.us.